We're back tonight with a KION exclusive. 5 nurses who work at the prenatal department at Salinas Valley Memorial tell us they've tested positive for COVID-19. And they claim the hospital did not provide them proper protections. And after months of pleading for more PPE and better visitor screening, KION's Josh Cristianto reports the nurses union is circulating a petition against the hospital management.
5 of the nurses we spoke with say they've tested positive for COVID-19 and are quarantining. They all say they know why. For months, the nurses tell me they've been pleading with hospital management for proper PPE masks like N95s, but instead they say they were dismissed and given only less effective surgical masks.
The way that they gave PPE to the emergency room, that's how they should have been giving it to us. Yet that's not what was happening. They just wanted us to wear surgical masks.
We were turned down. We were told that we were, and I quote, freaking out, And now I'm one of the nurses, unfortunately, of many who are positive on our floor.
The nurses also claim the hospital did not do adequate screening of patients and visitors to the perinatal floor, saying only basic questions were asked.
I cared for a patient, and then a couple days later found out that the patient, who at the time had been through the screening and told us, I guess, no symptoms. Well, unfortunately, later on, it was found that she did indeed have COVID.
The CNA says at least 8 nurses have tested positive in that department. They are now circulating a petition to push the hospital to make changes. But SVMH officials say they have been providing enough PPE to their employees. They say there isn't a medical facility anywhere that doesn't have COVID-19 positive cases. They also challenge the accusation that the nurses got COVID-19 at the hospital.
I am saying very clearly that there's no clear demonstration that they've developed this infection from a patient while at work.
Nurses disagree.
It's pretty funny that we all came up positive around the same amount of time, and we all had the same complaints about that we didn't have the proper PPE.
Anytime there's a nurse or employee or anyone in our facility that is at risk or develops an infection, we go out of our way to critically review that and improve everything we possibly can.